look at that. Isn't that a great layout? You son of a gun!
This campaign is no good.
No good!
Darren and Larry, the original Mad Men on Bewitched.
Hello, I'm John Malos, and welcome to Connect with Me, live on Comcast 187, 43.6 on the showroom floor. It's Friday morning, and you know what? It's Ask the Expert Day, at least on this day it is. We have a doctor in the house, a doctor who specializes in senior care. Those senior citizens who make, they have problems, medically speaking. Well, this doctor makes house calls. It's not a thing of the past. It's coming back. 265-4331. We're back in a moment.
Tonight I want to discuss the importance of the television medium to the American people.
I was asked to push the number today. Let's push the number. It's 265-4331. It's Ask the Expert. You know, we don't have a doctor in the house all that often. I'm not talking about Dr. J. Do you know who that is? Dr. J, Julius Erving, the former NBA star. They called him Dr. J. He's not here today. We have a real doctor in the house. So if you have a medical question and you're a senior and you're having problems, if you're disabled, you're having problems, you know what? Our guy makes house calls. Yes, he does. It's incredible. I've never heard of such a thing. Oh, yes, I have, when I was a kid, about 102 years ago. Anyway, let's go to the videotape, and I'll show you what I'm talking about. We're talking about senior cares, those people that are in very desperate need of medical care in this country. Dr. A.P. Sidhu of Fresno takes care of those people. He came here to the U.S. in 1994. He is from India. He did his residency in New York. He specializes in gerontology. That specialty is taking care of seniors. He practices internal medicine. He's been doing that since 1998. And I mentioned, yes, he does make house calls. Want to give your address on the air? He'll stop by your house on the way home today. No, not really. I'm just kidding. But you can call the number 265-4331 and ask his advice. He deals with the seniors at up to 20 different senior care facilities right here in the Central Valley, at Golden Living, at Sierra Vista, Pacific Golden, the Armenian Home right here in the city of Fresno, up to 200 patients under his care. Live in our studio right now is Dr. A.P. Sidhu. He is a gerontologist. He takes care of those senior patients. You can call in, ask the question of your choice, 265-4331. We're back in a moment with our doctor in the house.
Frigidaire. We introduced the first home freezer, the first pulsator agitator washer, and now we introduce the Frigidaire Orbit Clean dishwasher, designed with a unique wash arm that gives you 4 times more water coverage for a consistently better clean. Frigidaire, over 90 years of legendary innovation.
See the full line of Frigidaire appliances at Ventura TV Electronics and Appliances.
I'm pushing the number once again, 265-4331. Call in, ask the doctor a question. Dr. Sidhu, welcome to the program. How are you?
Doing good, John. Thank you. Thank you for having me here.
Good, good. So how is the medical industry these days? A little chaotic, huh?
I mean, I think you know better than us. There is a big issue with the recent Obamacare changes and flu season going on. And people are very concerned what's going to happen with their health, with their management in coming years. So
right.
There is a lot of anxiety out there.
Right, right.
Yeah.
So what's going to happen with Obamacare? I guess nobody knows at this point. Nobody read the bill before it was signed and passed into law. A lot of businesses say they can't insure some of these people now because they don't, they won't have the money. What's your take on what might happen with Obamacare? I know nobody knows and you can't give us a definite, but what's your take on it?
The sad part is that what we really needed is we needed a reform that will fix our problems of access, availability, cost. I guess what politicians did, they came up with a law that's I don't think so it's going to fix our problems.
How's it going to affect you and your patients?
I think it's going to affect us very negatively.
In what way, doctor?
There is a big push to make ACO organizations, what you call them accountable care organizations. What the accountable care organizations are, those are bigger organizations, bigger hospitals going to start their own ACOs. And what they're going to do, they're going to kill the American dream. They're going to try to, and this push is already going on in other parts of the country, where they will buy the other doctors' practices and they will manage your practices and you will become an employee.
Kill the American dream in what way?
I mean, the American dream is a small business. A lot of physicians has their own independence. They went to medical school for so many years. They came out, years ago they started their own private practice. And if you go back in history, a couple years ago, a lot of physicians who will come out, they will start their own private practice. You know, there will be no...
so you're saying under Obamacare, some of that may go away?
Yes. Most of the doctors are going to end up working. I mean, private practice still will be there, but if you see the trend, when I came out of medical, after finishing my residency in 1998, I was able to start my own practice. And I started my own practice as most of the docs have done, but now what's happening, physicians will be joining bigger corporations, will be just working as employees, because it is very difficult to start your own small business that is a private practice.
Are you going to go out of business?
I don't think so I will go out of business, but it will definitely affect us if we don't make the proper changes with time.
Yeah. So you're not in favor of Obamacare, I take it?
We definitely need a health care reform. Some parts of it are definitely good where people can maintain their insurance, but I guess does not really solve the underlying problem.
Right. Our number here is 265-4331, and we're talking to Dr. A.P. Sidhu. He is a doctor who specializes in gerontology. That means that he takes care of those patients that are older in years, the seniors. And he goes around to various homes in the community, up to 20 senior care facilities. So if you have a problem, you know what, he even makes house calls, which is unheard of in this day and age. You know, he goes to places like Golden Living, Sierra Vista, Pacific Garden, and the Armenian home here in the Fresno and Central Valley community here. And doctor, what out of all these patients that you see, up to 200, I can't believe you make house calls, by the way, what's the #1 complaint that you hear from seniors about their care and about their ailments? Other than the fact that, you know, we're all getting older, obviously.
Interestingly enough, that #1 thing you hear, that nobody want to be in these facilities, they want to go home.
Yeah,
okay.
I know.
But the #2 issue is the common aging problems are people live with chronic diseases. When I say chronic diseases, high blood pressure, diabetes, people live with
arthritis,
pain management, hearing problems, vision problems, looking at a patient as a whole. And dementia, Alzheimer's disease numbers are going up. People are, as people live longer, Alzheimer's disease numbers were like, there were 5 million, I think, last year, Americans who had Alzheimer's disease. And every 72nd, somebody is being diagnosed with Alzheimer's disease.
Take a call here. Good morning. You're on with Dr. Sidhu. How are you today?
Good morning. I'd like to know the doctor's opinion as to why it is not mandatory for healthcare workers, especially those working with the elderly, to receive flu shots to ensure the health and safety of their patients. Thank you.
Okay.
What was the question? Flu shot? What?
Has something to do with flu shots and elder care patients, you know, receiving flu shots. That's how I understood the question.
Yes. You know, it is definitely recommended for the elderly to get a flu shot, as long as
it's not going to hurt them, in other words.
No.
Okay.
No, in fact, if you look into the nurse, if you have anybody in a nursing home, you will see that there is a bigger push this year to make sure that these people get flu shot. And in fact, there is a way to measure the data from these nursing homes. They call it MDS, minimum data set. And if you print a report on these nursing homes from this minimum data set, government is making sure that they input how many their residents are getting flu vaccination and how many are getting a pneumonia vaccination. So it's recommended.
Yeah, pneumonia shot too. All right, another call. Good morning. You're on Connect with Me. How are you? Hello? You're on the air. Go ahead. Anyone home? I guess not. Okay. So let me ask you before we go to break, of course, we had a flu outbreak this year. Is it still prevalent in this country? And what about the people here in the Central Valley and California per se? What's the flu doing at this time, in this particular time and day?
You know, I think I don't need to even go to my patients. I'm just recovering from a flu.
So it's still prevalent?
It's very prevalent. All my kids are sick. I was sick last week. My nearby close friends are very sick. So it is out there.
Did you get the flu shot, by the way?
I did, but I don't know why I got it.
Okay.
But it is very important. If you didn't have the flu vaccination, get it. If somebody is sick, try to stay away from them at least 3 feet. Prevent it if you can.
Okay, another phone call before we go to break here. Good morning, you're on Connect with Me. How are you?
Fine, thank you. I'm watching you on TV. Let me lower the voice a little bit. I want to congratulate this doctor for doing what he's doing, making home calls. I know that was an old-fashioned idea, but I'm so glad that he's doing it. I do have a question for him about the type of flu that's going around right now. I got it pretty bad, and I had some x-rays taken, and I was told that I had a lot of infection in my head, and I was having headaches. But my regular doctor had said that it was because of the infection. I had already been put on amoxicillin, which is, I believe, a penicillin.
Yes.
I had been put on that type of medication and had been taking it for about 3 weeks, I think. And then I went to my regular doctor, and I got it again for 10 days. But I've always been told that it's only supposed to be for 10 days. So if you take it longer than 10 days, what would happen?
That's a good question.
You know, it depends how long you're going to take. If you're going to take couple more days, then over 10 days, nothing negative going to happen as long as you are not allergic to the medication. But going backwards, if you don't have a true infection and you are just dealing with a viral infection like flu or some other viral infection, then antibiotics may not be doing any good to you. It's going to just take its own course to go away.
Are you still on the medication now?
Yes, I had stopped it because I was afraid my son got after me about it because it had been more than 3 weeks that I had been on it. But then I got really sick again. I could barely breathe. So I thought, well, I need to take something. I can't even sleep like this. So I started the medication again because I still had some medicine left. So
That's
I'm
scary.
on it right now, but I'm only taking 2 per day instead of the 3. So it'll last till the next doctor visit.
What would you recommend for her?
I think, I think you need to make sure you go back to your physician and find out what is the true issue or true health problem you are dealing with, because you are taking this antibiotic for almost 3 weeks and symptoms are not going away. That means either it's not the right antibiotics or you are dealing with something else that the antibiotic is not needed. I would go back to the physician and say, I'm taking it for 3 weeks. What do I do now? I'm not getting better. You may need a CAT scan. You may need a blood culture or some other investigation. If I am in your shoe, I will do this.
And would you refer me to a specialist, like a sinus specialist or some other kind of specialist, or my regular doctor?
I think the starting point will be starting with your regular doctor, because he knows your whole history. He may have built some relationships with some specialists that I may not have. I may not be working with them.
You may not have access
to them. There are so many specialists, sinus specialists, 6 or 7. Some One doctor is with my last name. So I think the best thing will be go to your primary doctor. Anybody he recommends, depending on your history, then follow with that physician.
Do you think I should go ahead and finish the medication that my doctor gave me, the penicillin, the amoxicillin?
If you're getting better, then you can finish it. But if your symptoms are not improving, you are getting sicker, then you should not wait.
Oh, I see.
Yeah.
Okay. Well, that answers a lot of questions.
Well, I'm glad you called, and please take the doctor's advice. He knows what he's talking about. Go back to your physician. Yeah.
Okay.
Yeah.
Thank you so much.
I appreciate your call, and good luck to you. We're talking with Dr. A.P. Sidhu. Your phone calls are encouraged here. If you have any questions, any problem, like this young lady that called up and getting some advice from Dr. Sidhu, 265-4331. We continue to push the phone number and encourage you to call in.
When you need to talk to a private eye.
You want to be talking to Jim Rockford.
That's right. He's the one to talk to.
They don't know who you're talking to.
Rockford.
He's got everyone talking.
What kind of lowlife is he?
Takes out half-page ads in a phone book.
I seem to recall a phrase, moderately intelligent private detective.
You have a smart mouth. You're right, I do. But I'm working on changing that.
Jim Rockford is all the talk on MeTV.
He's something else, all right.
Weekdays at 11, 10 Central on MeTV.
Okay, remember, if you're watching us right now and I see we have a phone call and you want to call in, turn down the sound on your television set because we're going to get tremendous feedback, won't be able to talk to you. We do have another call for Dr. Sidhu. Good morning, you're on Connect with Me. How are you?
Fine, how are you?
Good. You got a question?
Yes, I need to find out. I'm highly allergic to codeine, and I have been admitted to the hospital twice, and they gave me medicine that had codeine in it, even though they knew I was allergic to codeine. Why is it that they are not reading their paperwork and stuff on the different medicines?
Okay, the way I understood it is, why are they giving her codeine when they know she's allergic to it?
I mean, you have a great question, but I think I am not the right person to answer that question. I think...
Isn't that gross negligence? I mean, that's a major deal. If you're allergic to penicillin or codeine, you shouldn't be taking it, right?
Yes, that is true, but I think I'm not the right person to handle it or answer how to handle it. The best thing you can do, if it happened in a facility, you can write a letter. Or every organization, every hospital has a quality management team, and they have a clinical teams who review these things and want to make sure these errors don't happen again. So one thing you can definitely do is write a letter or call the CEO or somebody else in that organization, but this error happened, make sure it does not happen again, so they can put systems in place.
But doctor, what do you do in the case of a senior citizen who's very ill and doesn't really have a spokesperson for them, or a family member that can really represent them properly and defend them in many of these cases, and they're too sick in bed, they can't write a letter, they can't get on the internet? What do you recommend in that case? Let's say that person is all alone, they have no family, and they're in a rest home, and they're given the wrong medication, they're not being taken care of properly. What can be done in that situation?
I mean, you know, some of these sad cases, situations are out there, but I think in our system, there are some ways to get maybe you can do in one of the segments, get a list of different resources to the seniors and maybe put on your website. There are some senior advocacy groups that will speak for you, and I think people need to know those numbers and names, and sad is I don't know all those.
Yeah.
So maybe we can work together on it.
Okay.
We can list on your site, you can take in one of the other segments, tell people where they can go if they don't have resources.
Right, okay, another phone call here for the doctor. Good morning, you're on Connect with Me. How are you?
Pretty good.
Good, speak up, please.
Okay, did I hear the doctor say that he got a flu shot, but he doesn't know why?
Yes.
Okay, because he visits a lot of area hospitals, right, where they have elderly patients.
Yeah, well, he got the flu, and he doesn't understand why he got it, and he actually got the flu shot.
After having the flu shot.
Yeah, yeah. Yeah.
Okay, because my question is this: healthcare workers who work at senior care facilities, a lot of them, I think, sometimes they refuse to take the flu shot, because for their own personal reasons or whatever, maybe, they don't want to do it. And yet that puts their patients at risk.
Yeah,
the elderly patients, they can die from the flu,
Are any of these healthcare workers, I guess what you're asking is it by law, are they required to take a flu shot?
I'm not aware of any law. I think people can still refuse. There is definitely a big push from Department of Health Services and CDC to educate these people the benefits of flu vaccination. What I have seen is that in previous years, the numbers of people, healthcare workers in these nursing homes who will take a flu shot, numbers are going up. Is it still 100%? Maybe not. Is there any law that forces them that they have to take it? I'm not aware of that. I strongly agree with you that can put those patients at risk, but I think on the other hand there is a people choice issue too. I don't know anything at this point that they have to have it.
Right. Okay. We're talking to Dr. A.P. Sidhu. He works as a gerontologist. He specializes in senior care. He's one of the hardest working doctors. He goes to about, 200, actually not 200. He takes care of about 200 patients, but goes to about 20 different facilities. After this show, he's driving out of town, going up to Turlock to another facility. That's just amazing. So he works around the clock to try to take care of you and your family. 265-4331 is the number. We're back with the doctor in just a moment.
Ventura TV Appliance Center. We're the low-price leading brands reliable advice place. The Whirlpool Dream Kitchen Get Yours Today place. Check this out. Right now, get huge savings on select Whirlpool appliances and pay no interest when paid in full within 6 months. At the hometown low price, think outside the big box place. Since 1951, Ventura TV Appliance Center. We're working hard to be your place.
Another phone call is waiting. Remember, if you're listening, turn down your television set if you're calling in. If you're not going to call in, then obviously don't turn it down. But we do have another phone call. Let's take it for Dr. Sidhu. How are you? Good morning.
Good morning.
Yeah, good. What's your question? Speak up.
I just want to he was my first doctor for emphysema. And I just want to say wish him well in his new profession. So they said my name is Robert Wells, and he had me diagnosed with emphysema in '96, and my emphysema is really getting bad. So there's really a lot you can do about it.
Do you have a question for Dr. Sidhu?
What Dr. Sidhu back in '96.
How are you, Robert?
Oh, you know him?
Yes.
One of your patients?
Yes.
Yeah.
Yes.
Are you still there?
Yes, I'm still here.
Okay. Do you have a question for the doctor?
I just want to wish him well. He's a very good doctor.
Mm-hmm.
My name is Robert Wells, and he diagnosed me with emphysema back in '96, and it's steadily going downhill.
Anything you can.
I just want to wish him the best in the world.
Thank you very much, Robert. Anything you can tell him to try to help him ease the pain a little bit?
Well, I'm sure, Robert. With COPD, if you are developing any signs of infection, get on the antibiotics and prednisone as soon as possible. Whosoever is your primary care doctor now or lung specialist, make sure you follow with quickly, because you want to prevent any major infection that can keep you out of the hospital with end-stage COPD. And good to hear your voice.
Right, great. And exactly, if you could explain, what is COPD? And emphysema is a disease of the lungs, right?
Yes.
Okay. Can you explain that a little bit more in detail?
Yes. COPD is chronic obstructive pulmonary disease. And emphysema is one type of COPD.
And it obstructs the breathing, the airwaves, or what?
Whatever the reason is, most common reason in Central Valley is smoking. That can damage your lungs. because of that damage, there is not proper perfusion when you take a deep breath. So there is not proper perfusion of that oxygen. So those people are more short of breath, and their lung capacity is down. They are producing more flame. Basically, in a nutshell, that's what it is. It really affects quality of life very negatively.
No cure.
There is no care, only symptomatic treatment.
Yeah. How long can a patient live with emphysema?
Oh, I think there is the life expectancy really depends on how severe the emphysema is, so on the severity of it. If it's a pretty bad FVC, there is a term when they check their breathing is very low, person can only walk 1 feet, get short of breath. Those people have a very bad, poor prognosis and life expectancy. On the other hand, if it's an early stage of COPD or emphysema, person is breathing, getting the inhalers, taking the medicine, can walk, can get up, people can even function, work, go to work.
Short amount of time left here on the program, 265-4331. We're talking with Dr. Sidhu. He specializes in senior care up and down the Central Valley. He is a hard-working doctor. Why do you make house calls in this day and age? I mean, that is simply unheard of. I haven't heard of a doctor making a house call since the 60s.
If you look at our patient population, we take care of the seniors in the nursing homes, and we take care of the seniors in the assisted living. And some of these folks have some sort of disabilities, like as you were mentioning in the beginning, they don't have family here. Let's say they have a stroke, they can't get up, go to the doctor. There is no way to provide care for them. And we have some sort of relationship with them in the beginning because we have seen them, so we just do it. It's just to take care of them.
Right. Well, you're a good doctor for doing that. Good morning. You're on Connect with me. How are you?
Hi. I'd like to talk to Dr. Sidhu.
Yeah, you're on the air. We got to move it along quickly because we got under 3 minutes left in the show. So go ahead quickly with your question.
All right. First of all, thank you both. Second of all, Dr. Sidhu, is there any way that I'm an in-home care person, and I take care of an elderly one.
Yes.
And is there any way that we can help him release some of the pain that he goes through at home while he is at home?
So let me rephrase your question. Your question is, can we manage the pain at home better? Is that the question?
Yes.
Yes, it can be definitely managed. I would like to leave you with a resource. 2 hospice companies in town, Nancy Hines and Care Hospice, also started a palliative program to manage the pain at home. So they can actually send one of their nurse practitioners just to manage the pain at home.
Is it like a therapist almost?
It is a clinician, a nurse practitioner.
Okay.
A family nurse practitioner. Both the companies, Care Hospice, I think their number is, if you want to write down, 447-2540.
One more time.
447-2540.
Okay.
If you call them and tell them that you want their palliative nurse practitioner to come and see the patient for pain management, so your patient can still carry on with their own primary doctor, but this nurse practitioner can come home, manage the pain, and implement different treatments working with your primary doctor.
Dr. Sidhu, sadly, we're out of time. I told you, remember how I told you this thing goes quick? It goes by so fast, the time. We got like 30 seconds. I sure appreciate it. We got no more time for phone calls. We had a lot of phone calls today. You do great work up and down the Central Valley. Dr. A.P. Sidhu works in gerontology, specializing in senior care. And I'd like you to come back and address our viewers for their concerns and questions again. Would you? Would you do that?
I will.
Okay, I appreciate it, Dr. Sidhu.
You.
You have a great weekend and drive safe up to Turlock, will you?
Thank you.
All right, stay put for just a minute. We're going to talk about Monday's show. You have a great weekend. We're going to talk on Monday to Jim Turpin. He is the news director at KMPH Fox 26. We'll talk to him about KMPH and, hey, what about that big sale, 47 buying 24. Have a great weekend. We'll see you Monday with our guest, Jim Turpin.